Pleasant day to everyone. So for this session, I will give you a lecture on the prevention and control of communicable diseases. So for the objective of the session, at the end of the session, the students shall be able to discuss the basic public health strategies for the prevention and control of selected communicable diseases, explain the salient features of the following government health programs on communicable diseases like the National Tuberculosis Control Program, the National Malaria Control Program, and as an added bonus, I will give you a lecture on monkeypox. These are my references: the Epidemiology for Health Administrator by Dr. Mercado, the Communicable Disease Module of the Prevention and Control of Communicable Disease and Community Diagnosis, and the Principles of Infectious Disease Control. For the global burden of disease, as you can see, for the last 30 years, there is a decrease in the number of communicable diseases in the world, and there is an increase in the number of non-communicable diseases in the world. Although during the pandemic, you can see a slight increase in the number of communicable diseases. For the global burden of infectious diseases, if we focus solely on the infectious diseases, you will see that the trend is also looking at a decrease in the number of communicable diseases or infectious diseases. But after the pandemic, there was a sudden increase in the numbers of communicable diseases in the world. This is the share of the total disease burden by the world in 2021. So as you can see from this slide, there are only 3 infectious diseases in this total disease burden by cause. But for the top 10, there are only 2 diseases, communicable diseases that are included, and that is TB and COVID-19. Okay, HIV/AIDS is below the top 10. For the top 10 global cause of death by WHO in 2021, 2 infectious diseases made it to the top 10. Number 5 is lower respiratory tract infection, and number 10 is tuberculosis. For the Philippine burden of disease for 2023, for the top 10 cause of death in the Philippines, 2 communicable diseases made it to the top 10. So one is pneumonia at number 5, and the next is TB at number 8. Okay. And for the top 10 causes of morbidity, so 5 causes of the morbidity in the Philippines into 2022 is caused by communicable diseases. And that includes acute respiratory tract infection as number 1, urinary tract infection at number 4, acute lower tract respiratory infection at number 5, pneumonia at number 7, and TB at number 9. We have talked about the ecological triad of the agent, host, and environment in your previous lecture, so I will not deal with this anymore. So suffice it to say that for there to be a disease, then there should be an imbalance in the agent, host, and environment interaction. Okay. So for the process of infection, there are 6 requirements for there to be an infection. One is the condition and environment. The condition and environment should be suitable for the agent and not suitable for the host. There should be suitable reservoir that should be present. Susceptible host must be present. And there should be a satisfactory portal of entry into the host and an accessible portal of exit from the host. And lastly, an appropriate means of dissemination and transmission to a new host. There are 4 outcomes of the agent-host environment interaction. The first will be that the host will ward off the pathogen, and if the host wards off the pathogen, then there will be no infection and there will be no disease. Second is the balance equilibrium. Balance equilibrium is the period when there is no apparent infection or an inapparent infection. This is the most dangerous time for the agent-host environment interaction, because at this point in time, the subject will be a carrier and he may be able to transmit the disease. But at this point in time also, while transmitting the disease, the subject will be able to evade detection and you cannot find the disease in the host in the subject. Next is the subclinical infections or the subclinical condition. The subclinical infection condition is the time wherein there are just 1 or 2 symptoms of the disease, and this is what we call as the prodrome of the disease. And lastly is the full-blown clinical case wherein you will find the pathognomonic characteristic of the disease. And this is the chain of infection. Okay, so for the chain of infection, these are the things that are needed for infection to ensue. So for the portal of entry, the agent should be able to enter the host, and there should be a susceptible host. There should be a pathogen or the agent, and there should be a reservoir for the agent or the pathogen. There should be a portal of exit for the agent and a mode of transmission. So we will look at these one by one. Okay. Pathogens are any element, substance, or force, whether living or non-living, the presence or absence of which can initiate or perpetuate a disease process. In other words, this is the cause of the disease, this is the cause of the infections. And the characteristics of the infection can be an inherent characteristic. Inherent characteristics of the pathogen includes the capsids, the size or the size of the pathogen, the cell membrane of the pathogen, or how infective the pathogen is. There are also characteristics directly related to man and characteristics related to environment. Okay. For the types of pathogen, these are the different types of pathogen that you can see. You have helminths, protozoan, bacteria, virus, etc. Some definition of terms. When we say infectivity means that this refers to the ability of the agent to gain access to the host. Okay, so infectivity refers to the proportion of exposed persons who become infected. Okay. Pathogenicity is the ability to set up a specific reaction, local or general, clinical or subclinical. Pathogenicity refers to the proportion of infected persons who will develop the clinical disease. Virulence refers to the severity of reaction produced measured in terms of mortality. So this is the proportion of persons with a clinical disease who would become severely ill or die. Okay. And antigenicity is the ability to stimulate the host to produce antibodies. So this is the antigen-antibody reaction of the host. With those definitions, we can now surmise that agents with high infectivity, meaning they can have a lot of people infected, and high pathogenicity, wherein there will be a lot of symptoms, but low antigenicity, wherein the host will not be able to ward off the agent. These three conditions will cause a relatively high disease prevalence in the community. Okay. But an agent with high infectivity but low pathogenicity will produce a mild or subclinical symptom in a carrier state. Okay, so this means that the subjects or the patients may not have any signs and symptoms, but they are still carrying the disease and they are communicable. Next, we have the reservoir. Okay, for the reservoir, we have the human, animal, and environmental reservoir. Okay, types of human reservoir, we have human carrier states. Okay, so for the carrier states, these are persons with apparent disease who is nonetheless capable of transmitting the agent. Asymptomatic carriers are subjects who have the disease, but they don't have signs and symptoms, and they will be able to pass on the disease. Okay. Incubatory or convalescent carriers are capable of transmitting the disease before or after they are clinically ill, and chronic carriers continues to harbor the agents for a long period of time. Examples of chronic carriers are patients infected with hepatitis B or Salmonella typhi. Animal reservoir are considered as zoonotic diseases. This is what we call as zoonotic diseases. So example for rabies, we have dog, cats, and bats. And for leptospirosis, rat bite fever, we have rats. And anthrax, brucellosis, we have the cattle. Vectors, on the other hand, are living organisms. You will have a lecture on vector and vector control after the first long exam period. So all of these will just be a brief review. Okay. So vectors are living organisms that transmit an infectious agent from an infected animal to a human or another animal. So vectors are frequently arthropods such as mosquitoes, ticks, flies, fleas, and lice. Okay. While vermins are pests or nuisance animals that spread disease or destroy crops or livestock. Okay, so this include see, the terms define in relation to human activities. Which species are included vary by region and enterprise. So this include rats. Okay. For the environmental reservoir, we have soil and water. So these are the uh, agents that would have predilection for environmental reservoir. Remember that parasites, soil-transmitted helminthiasis or helminths, can leave the soil for a period of 2 years. Okay, so they are just there in the dust particles in the soil, and they can be transmitted to humans uh, for 2 years. Okay. Tropism is the agent's preference to attack and stay in the special location in the host. Like cholera will opt to stay in the digestive tract. Staphylococcus will mostly be found in the skin. Herpes zoster will be found in the nerve system. And polio will be found in the anterior horn cells of the spinal cord. Okay. Next, for the chain of infection, we will have the portal of exit. For the portal of exit, we have the respiratory tract, the anus, and the skin. Okay, so respiratory tract, these will be the respiratory agents. And for the anus, this would include uh, soil-transmitted helminthiasis. And the skin will include uh, the sexually transmitted infections from the skin, okay, like herpes and pediculosis. So those are from the skin. Now, for the modes of transmission, we have direct and indirect mode of transmission. For the direct contact, and we have droplet spread and direct contact. So the monkeypox virus that is popular right now is transmitted through direct contact. Most of the transmission by direct contacts include those who are include the sexually transmitted infections. Okay. Droplet spread refers to spray with relatively large short-range aerosols produced by sneezing, coughing, or even talking. Okay. Droplet spread is classified as direct transmission because the direct spray over a few feet before the droplets fall on the ground. Example of droplet spread will be the respiratory syncytial viruses, tuberculosis, so flu. So those are by droplet spread. Indirect will include fomites, vehicle-borne. These are true fomites. Okay. This will include the pediculosis pubis, which can be transmitted by the by clothings of those infected. Okay. Monkeypox can also be vehicle-borne. Okay. And COVID can be vehicle-borne. Okay. Vector-borne, you have two types of vectors. You have your mechanical and biologic vectors. Okay? When you say mechanical vectors, the difference between a mechanical vector and a biological vector is that in the biological vector, there is a reproduction of the agent in that particular vector. Okay? Yeah. So example, uh, of mechanical transmission is Shigella. Okay, so that's an example of mechanical transmission. Okay, while example of a biological transmission is malaria. Okay. Airborne can be by aerosol or dust. So as I've said earlier, dust include your soil-transmitted helminthiasis. Okay, and aerosol will include your TB. So these are the different modes of transmission and some of the disease that can cause that mode of transmission and some examples. So for direct contact, mostly sexually transmitted diseases, skin infections, and scabies. Droplets, we have pertussis, common cold, strep throat, meningitis. Indirect contact with the contaminated surface includes skin infections and diarrheal diseases. Vectors include Lyme disease, La Crosse encephalitis. Vehicle includes diarrheal diseases, hepatitis B. And airborne includes TB, chickenpox, smallpox, SARS, and others. So now we go to the portal of entry. For the portal of entry, we have the respiratory tract, intact skin, GAT, mucous membrane, the gut, and your placenta as part of your uh, portal of entry. Okay. So respiratory tract portal of entry includes those who are includes the respiratory infections. Intact skin includes the sexually transmitted infections. Gastrointestinal tract includes those who goes through the orophycal route. This includes the diarrheal diseases. Mucous membrane include HIV, okay, and genitourinary tract includes the sexually transmitted diseases also. And placenta, this includes those who have mother-to-child transmission. This includes HIV and the famous monkeypox right now. So after the portal of entry, we go to the host factors or the susceptibility of the host. So the host factors include age. We all know, sorry. So for the age, we're all aware that uh, different diseases varies depending on the age. So some diseases, especially infectious diseases, will affect the young and the old as compared to those in the middle ages, okay, or the adults. Okay. So diphtheria and measles occur mostly in children because of absence of immunity. And schistosomiasis is observed more among adults. For sex, so vaginal infection, syempre, are only seen among females. HPV are more common among women than males. Coronavirus are more common in males, so with TB and HIV. For race, so COVID, study showed that COVID has a higher infection rate for Asians, okay, as compared to whites. Okay. For the culture, okay, among Muslims, you will not find, it's very hard to find cases of Tania solium. Why? Because Muslims do not eat pork. Okay. You can also have the old practice in the Philippines of cutting the umbilical cord by use of bamboo. So that would cause infection. Okay. And then we have the different defense mechanisms. Okay, so for the different defense mechanisms, you have anatomical defense mechanism. The anatomical defense mechanism include the skin. Okay. And we have the immunity. We have the passive and active immunity. The passive immunity includes the maternal transfer of natural immunity from to the child. Okay. Active immunity, this is attained by natural infection or by giving vaccines. Okay. Inherent susceptibility is the ability of the host to resist disease independent of the antibodies. Okay. Resistance is the sum total of all the body mechanisms of all of these, which would prohibit the infection from the host. Okay. Tolerance is a term applied to the condition whereby the infectious agent can be demonstrated from the individual and yet the person does not show clinical manifestation as should be expected. Okay. And lastly, premonition is a term applied to the condition of refractoriness to further infection in an individual already sick or harboring already the infectious agent. Okay. For the incubation period is depends on the virulence of the agent, the dose, and the portal of entry. It also depends on the host defense mechanism and the inherent characteristic of the agent. Okay. So rabies, for example, has a shorter incubation period. What is the importance of the incubation period? So incubation period is important in identifying the point source of propagated epidemics. When we give you a lecture on disease outbreak, we will show you how to compute or how to determine when is the source of the epidemic. Okay, so and that will be based on the uh, incubation period. Okay, so we can also trace the source of the infection and the contacts through the incubation period and the period of surveillance also during outbreak. So up to when are we going to watch if the outbreak has already receded, okay, or controlled. Okay. Incubation period is also important for immunization. So for example, for rabies, we cannot give, it is useless to give rabies vaccine after the incubation period. If the patient already has the signs and symptoms of rabies, then even if you give the vaccine, it will not have any effect. Okay, the patient will still die. Okay, and lastly, it is important in identifying the end of the outbreak or the epidemic. So again, we will show you this during the lecture on outbreak. Communicable period is the time wherein the infectious agent may be transmitted, okay, from one host to another. Okay. So example of communicable period. So chickenpox, this is an infectious disease caused by varicella zoster virus. Okay. So the latent period for chickenpox is shorter than the incubation period. So a child with chickenpox become infectious to others before developing the symptoms. Okay, so this is the incubation period of chickenpox, and this is the infectious period of chickenpox. Okay. Other examples. So HIV has a latent period which is relatively short, and the infectious period occurs years before the onset of symptoms. Okay, so this is the history of HIV. So the latent period is short. So the infectious disease is very, very long for HIV. Okay. For malaria, caused by protozoan parasites of the genus Plasmodium, the stages of the parasite that are infective to mosquitoes occur about 10 days after the development of symptoms. Okay. So the latent period is around 10 days longer than the incubation period. So early treatment of symptoms could have an important effect on the transmission. So this is the natural history of disease of malaria. As you can see, this is the incubation period, and this is the latent period, and the infectious period is after the signs and symptoms have begun. Okay. For the levels of prevention, you already have a lecture on the levels of prevention. So this is just a review. I will not dwell on this extensively anymore. So we have the primary preventions. For the primary prevention, we have health promotion activities like health education. And we have the specific protection. For the specific protection, we have segregation, which is categorized into isolation and quarantine. And we also have the control of means of spread through vector control or environmental sanitation. And we can increase the resistance of the host by immunization or chemoprophylaxis or by having some mechanical barriers. Okay. So you must remember that the difference between isolation and quarantine. So you isolate those who are infected and you quarantine those who have been exposed. Okay. So there was some problems during the COVID-19 infection, the pandemic, because they used the general term of quarantine for everyone. Okay, so they quarantine even the infected person. So that is wrong. So if the patient is infected, you do not quarantine that patient. You isolate that patient. So that he cannot transmit the infection anymore. Okay. These are the categories of isolation. You do not have to memorize these. This is just good to know. Okay, so on your second year or third year, then that's the time that you need to know of all of these. Okay. For the secondary prevention, so we improve the utilization of services through health education. We do screening and case finding activities and treatment. Okay, so that's secondary uh, prevention. Okay. So for screening, we have different types of screening. So when we say mass screening, we screen the whole population. Okay. So sometimes we do that for soil-transmitted helminthiasis. Okay. We do targeted or selective screening. When we say targeted or selective screening, we do that for special population. Like we do selective screening for the commercial sex workers, for STDs, and for factory workers. We also do that sometimes, especially for factory workers in cotton mills. We want to screen them for pneumococcis or brucellosis. Yeah. Opportunistic screening is done when the patient, for example, went to your clinic and he has no signs and symptoms. But based on PHEX, he should have the patient is already 50 years old, male, so he should have endoscopy already. So you will recommend that the patient will have endoscopy. Okay. Individual and mice case finding. Example of this one is educating teachers to detect scabies in the residential schools. Okay, so that's individual and mass case finding. Tertiary prevention. So we all know what tertiary prevention is. So tertiary prevention is the application of rehabilitative measures in order to maximize the use of the remaining functions. So this also paved the way for the individual's return to a useful place in the society. So tertiary prevention includes physical rehab, psychosocial rehab, occupational rehab, and this is very important, especially for family med, psychological counseling for grief. This we do this if you will have mortality, okay? Or if the patient is already dying, then we have to give counseling so that they will be able to accept the outcome. Okay? So these are some of the infectious control measures. For direct contact. We may use barriers like condom, clothing, or dressing. For droplet, we advocate respiratory etiquette. For indirect contact, we use hand hygiene and sanitizing infected surfaces. For vector, we use vector control. For vehicles, we use proper hygiene and sanitation. And for airborne disease, again, we use respiratory etiquette. Control measures that can be applied to the hosts. We do active immunization and passive immunization. We can also have chemoprophylaxis. Like for malaria, we give doxycycline. Okay. We also recommend behavioral change or cognitive behavioral therapy. Sample of that is for smoking. Can also do reverse isolation instead of the subject being isolated. The contacts will be the one who will be isolated. Can also have barriers, and we can improve host resistance by giving nutrients, okay? Improving the nutrients. Mechanisms applied to vectors, we have chemical, like the insecticide is spraying, okay? Environmental, like the fishes that can be used to uh, destroy mosquitoes, okay? And biological example of these are genetically modified mosquitoes. Genetically modified mosquitoes are mosquitoes that cannot fly, okay? So, yun. We did that in Muntinlupa City before. We released genetically modified mosquitoes in Muntinlupa. Unfortunately, that program did not succeed. Okay, so the uh, cases of dengue. So we did that for dengue. The cases of dengue still did not decrease after the genetically modified mosquitoes. Okay. Yeah. For environmental pala, it also include placing fly traps and constructing rat-proof houses. Okay. The 4 o'clock habit is also an example of an environmental control. Applied to the environment, we have provision of safe water, proper disposal of feces, food and milk sanitation, and proper design of facilities and equipment. Okay. So for control of communicable diseases, it's very important also that you will be able to define the following terms. Okay, eradication means permanent reduction to zero of the worldwide incidence of infection caused by specific agent. Okay. Elimination is reduction to zero of the incidence of a specified disease in a defined geographical area. Okay. As you can see later on for malaria, we are now in the malaria elimination phase. Okay. In the Philippines. Okay. Extinction, the specific infectious agent no longer exists in nature or in the laboratory. Okay. For eradication, smallpox, in the family of monkeypox, has been eradicated but not extinct. Okay, the reason why it is not extinct because smallpox can still be seen in level 4 laboratories in the world. Okay, so still present. Okay. Control measures applied to agents include cleaning, cooling, pasteurization, disinfection, and sterilization. So this is an example of infection control program in a workplace scenario. So the infection control program includes immunization or vaccination of the employees, proper waste management. We collect the waste, we segregate the waste, especially the infectious waste. Cleaning and disinfection of the environment, especially the operating room, safe use of sharps, and having a sharps box. Okay. Use of personal protective equipment. We see a lot of those during the COVID pandemic. Hand and respiratory hygiene. Training of the employees. Okay. And standard precautions, as always. Okay. So this is an example of an infectious control committee program, okay, in the workplace.
It is important that all staff are aware of disease-related hazards in their workplace and know how to protect themselves against infectious diseases. Often, illnesses that may show mild symptoms in children are much more debilitating to adults. Standard precaution for infection control are a set of practices that are based on the assumption that all blood and bodily fluids are considered potentially infectious. One example of a standard precaution is regular hand washing. It is also important to know your personal immunity status for all relevant diseases. Most childhood diseases are now vaccine preventable. Sometimes, despite our best efforts, we can become unwell. During this time, it is strongly encouraged that staff and students stay home until they are no longer contagious. Your health is valuable. So remember, if you're aware of it, take care of it.
So this is an example of case analysis. Okay, hookworm infection is caused by parasites which are common in Ethiopia. The parasites live in the human intestines and lay eggs which are expelled from the body with the feces into the soil. Okay. The eggs grow into worms in the soil which penetrate the skin of people walking barefooted. Now, we identified each of the following in this example. So infectious agent. So what do you think is the infectious agent for this one? So if you answered hookworm or helminths, then you're correct. How about the reservoir? So if you answered soil or environmental reservoir, that is also correct. How about the mode of transmission? So if we answered indirect through the soil, then that is also correct. Route of exit and route of entry. So route of exit will be through the feces, and route of entry is through the skin. Okay. In summary, I have discussed the global and Philippine burden of communicable diseases. I have also discussed the chain of infection and how to prevent communicable diseases. So these are my references for the lecture. And thank you very much for your attention. If you have any questions on this lecture, you may use the discussion section in Canvas to write your questions, and I will answer them. We will also have a short question and answer portion during the session, okay? And that will be synchronous or live question and answer portion. So thank you very much again, and please don't forget to evaluate the lecture.